Next, we'll go to items number 9, AB 623, Assemblymember Wood, and 23, AB 1231, Assemblymember Wood.
Thank you, thank you, Chair and members. I'd like to, with your permission, actually move 1231 first. Is that okay?
Of course.
Okay, great. Thank you very much. Chair and members, many Medi-Cal beneficiaries have reported difficulty accessing specialty health care due to a lack of adequate transportation. In some cases, families have reported driving over 4 hours for a one-way trip to see their specialist provider. This issue is especially magnified in rural districts such as mine. Non-medical transportation is defined as transportation of members to medical services by passenger car, taxi cabs, or other forms of public or private transportation, and is only a covered Medi-Cal benefit for children. Unfortunately, for all other beneficiaries, non-medical transportation is an optional benefit that health plans may provide. Although health plans provide this service, beneficiaries have reported difficulty accessing the service due to a wide variance in the policies and procedures. Currently, licensed plan must have primary care services within 30 minutes or 10 miles and hospital services and emergency care within 30 minutes or 15 miles of a member's residence. Right now, there are no geographic or timely access standards for specialty care, but the California Department of Insurance standards for specialty care are within 60 minutes or 30 miles of a residence or workplace. AB 1231 ensures that low-income beneficiaries, especially in rural areas, have access to transportation for their specialty care needs. The bill requires that non-medical transportation be provided to specialty care beneficiaries if those services are more than 60 minutes or 30 miles from the beneficiary's place of residence.
We have a motion and a second.
Thank you. Here with me in support, Linda Way from the Western Center on Law and Poverty.
Good afternoon, Chair, members. My name is Linda Way with Western Center on Law and Poverty, proud sponsors of this important measure. AB 1231 would help rural consumers access specialty care, thereby potentially reducing the need for costly emergency care. I'm here to answer any technical questions, but with me is Liza Than-Tranon from Legal Services of Northern California to highlight what this bill would mean for rural consumers.
Good afternoon, Mr. Chair, committee members. My name is Liza Than-Tranon. I'm the managing attorney of the health unit at Legal Services of Northern California. We provide legal services to health consumers in 32 Northern California counties, many of which are very rural. It's not surprising that access to specialty care can be very difficult in rural areas. There are simply just fewer providers there. However, that problem has been compounded by the transition into Medi-Cal managed care and with the huge influx of people into the healthcare system. Since the rural expansion of Medi-Cal managed care, we've seen an increasing number of people who are having difficulty accessing specialty care. Rural residents are increasingly being sent further and further away to access specialty care, and they're frequently calling us for help. While they're frequently very grateful to get just an appointment with a specialist, a lot of times they often end up having to cancel those appointments or end up having to forego care because they simply can't afford the travel that's required for them. So one consumer that did call me was a Nevada County resident who's enrolled in a Medi-Cal managed care plan. Nevada County is pretty close to the Nevada border. She called me because her primary care physician had referred her to a rheumatologist, and initially the referral coordinator at her doctor's office had difficulty just locating a rheumatologist for her to go to. So after I intervened, we had the health plan facilitate finding a referral for her, and the closest referral they could find for her was a rheumatologist in San Francisco. That was an almost 8-hour drive, 324 miles round trip for her. For a low-income person with 2 little girls, that was a significant financial burden for her to drive to and from San Francisco, as well as childcare expenses. So this case was not an anomaly, but is pretty illustrative of many of the cases that we have. We're seeing lots of clients who are having to travel similar distances to access specialty care. So we'd strongly encourage support for this bill. It would really be an important step towards ensuring that rural folks and low-income people are still able to access specialty care when their health plans aren't able to provide it within a reasonable distance. Thank you.
Thank you. Additional witnesses in support.
Beth Capel on behalf of Health Access California, pleased to be in support.
Sean South on behalf of the California Primary Care Association in support.
Eduardo Martinez, California Medical Association. Access to specialty care in Medi-Cal is one of the biggest issues we hear about from our members. We're in support.
Thank you. Seeing no more witnesses in support. Witnesses in opposition. Seeing none, questions or comments from committee members? Seeing none, we have a motion, we have a second. Would you like to close Dr. Wood?
I respectfully ask for your aye vote.
Thank you. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Chavez? Chu? Chu, aye. Gomez? Gomez, aye. Gonzalez? Gonzalez, aye. Hernandez? Lackey? Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas, aye. Rodriguez? Santiago? Steinnorth? Steinnorth, aye. Thurmond? Waldron? Waldron, aye. Wood?
Aye.
Wood, aye.
The bill passes 13-0. You can present on your other bill.
Great. Thank you very much. First of all, I'd like to thank the committee for this. This is AB 623. I'd like to thank the committee for their move to actually begin a California health benefits review of this item, and I appreciate that, pushing them moving forward. AB 623. More than 60 people die every day in the United States from prescription drug overdoses. Approximately 6.5 million people in the U.S. abused prescription drugs in 2013. Prescription drug abuse is more than double the amount of drug abuse from heroin, cocaine, and hallucinogens combined. In one of the counties I represent, the addiction rate for prescription medications is twice the state average. As a dentist, I treated patients with oral facial pain who had legitimate reasons to use prescription drugs. Unfortunately, I've also seen a number of individuals who become addicted to prescription drugs. This bill is not a bill to limit medication for people who truly need it for pain. Crushing, cutting, dissolving pain medication for injection or inhaling through the nose is common and dangerous among addicts and abusers. This is what also leads most often to overdose. The high is intense and the effects are almost immediate. This epidemic of drug abuse disproportionately affects our young people. 70% of the people abusing these powerful pain medications report getting this medication from a friend or a family.
We have a motion and a second.
Often just taking it out of a medicine cabinet, which makes the education component of this bill so critical. AB 623 widens access to abuse deterrent formulas, are called ADFs. ADFs incorporate a breakthrough technology that protects against manipulation and abuse. Scientists have proven the effectiveness of ADFs by taking mortar and pestles, hammers, blenders, whatever, to try to annihilate the pills. The result, the pill remains whole and impossible to inject or inhale. AB 623 would allow healthcare providers to prescribe a less than 30-day supply of opioids. Healthcare providers will also be able to determine when an ADF opioid is medically appropriate to be administered. AB 623 will require pharmacists to inform patients on how to store and dispose of opioids. This is not a magic bullet. It's simply another tool to help curb abuse and save lives. Maybe 20 to 30% of those abusing drugs, or about 6,000 people per year. We've heard from groups that oppose the bill, some of their concerns, and I don't believe they are all completely correct. Providers can continue to prescribe traditional opioid drugs. It does not mandate that provider prescribe this formulation only. There are generics in the pipeline, and there is at least one available now. Some point out that patients can simply take more of the pills and continue to abuse them, and I would agree. However, this is not the kind of abuse I'm trying to address. I'm trying to curb the manipulation of the drugs for those intense immediate highs that lead to overdose, and that is why the abuse deterrent formulations will be a tool to help fight this sort of abuse. There is no perfect tool to get the job done, which is why it's so valuable to have multiples available. This is one that will be available for doctors to use on patients who could benefit from these formulations. With me today are Brent Meyer, the Vice President of PORAC, and Paula Cohen from the Mendocino Coast Clinics, and then we have Maggie, and I'm sorry, I don't remember, Buckley, who will address this. So I thank you very much.
Thank you.
Good afternoon, Mr. Chairman and members of the committee. My name is Brent Meyer, and I'm the Vice President of PORAC, the Peace Officers Research Association of California. which represents nearly 68,000 public safety officers and 920 public safety associations. Prior to being elected by my peers as Vice President of PORAC, I was the President of the Sacramento Police Officers Association, and for nearly 20 years, I've worked in the patrol division of our police department, which prides itself in the ability to conduct a community-oriented policing program and solving neighborhood issues. Unfortunately, I've seen firsthand the terrible impacts on our society. This problem, tragically, is not just one isolated to street drugs. We must now contend with an explosion of prescription narcotics making their way onto the street. The misuse of prescription drugs has reached a crisis level, and the solution to this profoundly personal and societal problem is not simple. The numbers are daunting, and they are worth repeating. Almost 1.5 million Californians, 12 and over, were estimated to have abused painkillers last year, and 7% of our adolescents use pain relievers for a non-medical purpose. We must do something. If we're going to resolve this problem, the approach will involve multiple agencies and require a multi-layered approach that crosses all socioeconomic and political barriers. There is not one solution to this problem. The solution must also make sense in the world that we have given today. We must make the ability to actually abuse prescription drugs more difficult. I've been to meetings personally in which the cost in the loss of productive lives and the associated criminal behavior are lumped in with the abuse of prescription drugs. I've written a little bit about the benefits of abuse deterrent formulations, or ADF. Opioids may arrive in pill form, but the abuser has learned how to crush or dissolve the pill until it's presented for snorting, smoking, or injecting. And it should be noted that this particular violation of the original form of the medication is a leading cause of emergency overdoses and death. I know, as well as my colleagues in law enforcement know, that abuse deterrent formulations can help us on the streets. The street value of these pills goes down to nothing when they can't be tampered with to create the kind of immediate high that many kids are seeking. ADF technology is effective and essentially removes the temptation to steal ADF-enhanced medication for any other purpose except for that for which it's intended. I believe Assemblymember Wood is on the right track with this legislation. This bill is tightly drawn and will make a real difference in combating a real problem. So with that, I ask for your support.
My name is Paula Cohen, and given the lateness of the day, I'm going to be very, very brief. I'm from Mendocino County. We're 3,500 square miles. We have 88,000 people about, so it's about 25 people per square mile. So that kind of gives you the idea of how big we are. We're known for being very independent, free thinkers, and a whole lot of other things. And the other thing we're becoming known for is that we have an increasing problem with opioid and just drug issues. Excuse me, not unlike many other small counties. While we know that there were changes and problems, last September a report from our Mendocino County Public Health Department came to light, and which showed that the emergency department visits for people who are suffering overdoses from opioids was twice the state average. Excuse me, the hospitalization for opioid poisoning was also twice the state average. The death rate from opioids, it puts Mendocino County in the lower third of the state. While everybody's been talking about this is really a societal problem, we need to have some way to have some small steps to make it work. Our providers in our community health centers are begging us to find ways that we can start reversing this trend. And while this will not cure all the ails, I believe that AB 623 will go a floor way to start that dialogue.
My name is Maggie Buckley. I'm a volunteer patient advocate from Contra Costa County, and thank you for allowing me to speak today. I live with chronic pain due to a condition called Ehlers-Danlos syndrome. It's a genetic connective tissue disorder that causes joint dislocations, easy bruising, fragile organs, etc. In the 40 years since I was diagnosed, opioid-based pain medications have been a part of my multimodality pain treatment plan, and I've come here today to share why abuse deterrent formulations are key to ensuring that these analgesics remain available to valid pain patients. I've been fortunate in that my healthcare plan and family and friends have covered enough options so that I'm not entirely reliant upon pain medications. Insurance coverage only promotes prescription medications and very limited physical therapy, which for me is not enough to manage chronic pain that I live with every day. As these medications are popular for people who want to get high and are easily acquired by raiding a friend or family member's medicine cabinet, valid pain patients like myself then become crime victims or are assumed guilty of drug crimes. Abuse deterrent formulations are a way to make these analgesics less attractive to abusers and give providers another option to better care for the patient. Expanded education and awareness of how to store and dispose of analgesics is key to disrupting the diversion of prescription medications. Thank you.
Additional witnesses in support?
Yeah, Chair and Member Sean South on behalf of the California Primary Care Association in support.
Additional witnesses in support?
Twinkle Van Fleet, Power of Pain Foundation. Power of Pain Foundation is a co-sponsor of this bill, and we would like your support. Thank you.
Good evening, Mr. Chair and members. Corey Salzello on behalf of the California State Sheriff's Association in support of the bill.
Megan Maddox with the California Pharmacists Association in support.
David Gonzalez on behalf of CHI in support.
Alicia Sanchez representing the California Medical Association in support.
Catherine Austin Scott on behalf of the physician assistants. Support.
Excellent. Thank you. Additional witnesses in support? Witnesses in opposition?
Good morning. Good afternoon. Howard.
Whenever you're ready.
Good evening. John Caldwell on behalf of the Pharmaceutical Care Management Association. We're the nationwide representative for pharmacy benefit managers. While we understand the author's desire to reduce drug abuse, we believe that this legislation will not accomplish his goal, and it will dramatically increase cost for health care. First, we understand the problem. As drug prices continue to increase, payers, now more than ever, are looking to contain the cost by implementing effective programs that ensure safe and appropriate use of opioids. Health plans and PBMs take a number of steps to combat the misuse of opioids. Plan and PBM systems are able to find such irregularities as early refills, day supply compliance, visiting multiple physicians, visiting multiple pharmacies, medication dosage limits exceeded. But as to the proposal before us, while abuse deterrent formulations have been developed to prevent opioid medications such as OxyContin from being crushed, dissolved, chewed, cut, this does not prevent abuse and potential overdose. Per your own committee analysis, the FDA also noted that abuse deterrent technologies developed to date have not yet proven successful at deterring the most common form of abuse, swallowing a number of intact capsules or tablets to achieve a feeling of euphoria. According to the New England Journal of Medicine, after the introduction of abuse deterrent formulations of OxyContin, abusers significantly lowered their use of OxyContin, but increased use of other opioids, such as heroin. The authors of that study concluded abuse deterrent formulations may not be the magic bullets that many hoped they would be in solving the growing problems of opioid abuse. The federal government has reached the same conclusion. According to the Substance Abuse and Mental Health Service Administration, the abuse deterrent formulation of OxyContin may have led potential abusers to switch to heroin. And they note overall rates of heroin use have been increased significantly. While this bill will do little to improve opioid abuse problems, it will increase costs. As noted in the analysis, JBIRP has not had an opportunity to review the bill for cost, but this idea has been studied in other states and found to be costly. For example, the state of Tennessee determined that similar legislation would raise premiums statewide. For Tennessee State Employee Health Care Plan alone, the cost was estimated at $11 million. That's for a state with one-fifth the population of this state. Now, we understand more must be done to reduce the abuse of opioids and other controlled prescription drugs while ensuring patients with both temporary and chronic pain are safely and effectively treated. Mitigating the opioid abuse problem will require more than a magic bullet. It will require a coordinated strategy involving education, counseling, treatment, law enforcement, time.
Additional witnesses in opposition.
Thank you, Mr. Chair and members. Mira Morton here today on behalf of the California Chamber of Commerce, also regretfully in opposition. We definitely appreciate and share the author's concern about opioid drug abuse. It has caused far too many deaths, far too many overdoses, and it also is a huge cost driver for employers, especially in the workers' compensation market, where it is estimated that 3% of the physicians, about 10,000 physicians, are responsible for over 55% of the prescriptions for Schedule II and higher painkillers. So this is a very real issue for employers and one that we are committed to helping all of you solve. What we are not convinced of is whether AB 623 is going to help move the ball forward in that area. Certainly, we've heard testimony today about what the FDA has said. I would just like to add their comment that available abuse deterrent formulations are expected to provide improvements over existing formulations, but their impact on the abuse epidemic may be limited. And if their cost is going to be higher, we think it's appropriate that we have a thorough analysis done by CHBRP. And until then, we really don't know what the cost will be, what the benefits will be, and if it's going to be worth it, if it will save lives, and if it will move the ball forward. And as such, we are opposed at this time. Thank you.
Thank you. Additional witnesses in opposition.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies, also opposed.
Angie Minetti with the California Retailers Association, also opposed.
Nick Luizos, California Association of Health Plans, opposed.
Maureen Higgins representing Express Scripts, also opposed.
Questions or comments from members?
Yes.
Member Ridley Thomas.
Yes, Mr. Wood. What's the problem with waiting to get an evaluation from our, I don't recall the acronym, the UC CHBRP?
CHBRP. It sounds like a, yeah.
Involuntary
CHBRP.
reflex.
Sorry.
Yeah.
No, actually, that process is beginning. The committee recommended it. That process is actually going on.
So maybe they'll wait until they're done with their analysis to move the bill.
I would agree if this were a brand new medication. However, this is a different formulation of existing medications. So that's why I believe that the committee has allowed me to move forward here today.
Developments in medicine have made these drugs harder to abuse and get more and more doses that will that can be abused. I'm thinking of a few years ago when there were all kinds of discussions about kind of chemical manufacturing you can do to make sure that you get the appropriate dosage if you need care, but that they're not abused. Do you acknowledge that? Do you see the medical innovation that is occurring in order to accommodate that with respect to manufacturing the physical product?
Actually, that kind of plays into what I believe is the ADF, is the whole concept behind the ADF, which is actually to create a product that is more difficult to manipulate. Currently, the typical formulations of OxyContin are very easy to crush between spoons. I demonstrated that recently. You could then snort that, you could liquefy it and inject it, and the high is immediate. So I'm not trying to, I fully recognize that you could overdose by taking more pills, but that's not the way this drug is really being abused by our young people. And that's what I'm really focusing on, is on young people. They're the ones who are doing this in this other way. And, it's not a magic bullet. I freely admitted that up front. It's just one more tool to help us to try to curb abuse.
Are there particular areas where this is a bigger issue than in different parts of the state? Is there disparate concern with respect to the abuse concerns? Is it North State, Central Valley, Southern?
I believe that, and I don't have all the statistics in front of me, but I believe that that is a problem throughout California, and particularly in my district, in one of my counties, where the abuse rate is twice the state average, and that's very disturbing.
Well, I'll support the bill as a courtesy, but I have significant reservations about it. This is going to appropriations next?
It's going to BNP.
Oh, BNP. All right. Well, should it see its way to the floor, I'm going to monitor it, and I'll express my further concerns in private. Has the bill been moved yet?
Yes, we have a motion and a second already.
Thank you, Mr. Wood.
Thank you. And just to comment on Assemblymember Ridley Thomas's point about CHBRP, the CHBRP process is underway, as Assemblymember Dr. Wood has stated, and we expect a CHBRP report in May. So it'll be back right in the middle of the process to be fully considered and vetted and be integrated into the legislative process. Assemblymember Patterson, then Waldron.
I just wanted to express a similar concern of my colleague with respect to the process. I really think that it is appropriate for us to act upon legislation when it's been fully informed by the necessary research and all of that. And so I will not be supporting it today. I also want to just encourage us to be thinking less about the pill and more about the people. It is not the pill's fault. People are abusing, and they will continue to abuse. And I appreciate the energy put into this, but I do think we need a lot more energy in trying to help change hearts and minds of young people when they're engaging in this, and trying to get them the kind of help that they need. Frankly, if this were my children, I would be less worried about the fact that they can crush up some pills, is that they are crushing up some pills. They will find some other way to get the high. This is a behavior a problem, a education issue, a treatment issue that I would love to be supportive of. I'm not convinced this does it, but I do appreciate your effort.
Assemblymember Waldron.
Thank you, Mr. Chair. In my former life, I actually, when I was on the City Council, participated as a member of the San Diego County Oxy Task Force, which came out, 8-9 years ago or so. And at the time, all we kept hearing about was, this issue with young people abusing opioid drugs and prescription drugs is happening in the East Coast, but it's coming here and we better be ready. So one of the things I had done was set up hearings in my city regarding it so that parents could be alerted, because parents, I still don't think, know what to look for. And we work with the San Diego County Sheriff's Department, who is very active. They have a couple of sheriff's deputies who have been just totally immersed in this. So as part of that, I got to learn a lot about it, which I didn't think, even existed. But what we've seen, and as was mentioned, how the growth has just exploded as the years go by. And in San Diego County, top 10 drug deaths, oxycodone or Percocet is right up there. And the top, it's 4, but number 3 is heroin, which is basically the segue of what the Percocet leads to. What we found was in San Diego, there was we used an example from our task force, a young person, 17 years old, who started to use OxyContin, and basically by just melting it on foil and snorting the fumes, got an immediate high. It was totally, from that point on, hooked. And then it got into being where they start stealing, so it becomes not only a drug issue, but now it becomes they're stealing from people, it's a criminal issue. These young people go down this path, then they can't get the drugs, they end up on heroin because it's cheaper. So basically, I'm supporting the bill. I think it's a great concept we need to be looking at. I know there's costing that has to be done, but one of the things we learned in our Oxy task force was that society has developed this belief that, pills can cure, and if it's prescription, it can't be that harmful compared to some of the drugs they're getting out on the street. But that's not true. Teens feel using RX drugs to get a high is much safer than the street drugs. But it's estimated that almost 30 million people use prescription drugs non-medically. So the scary thing is we're seeing people as young as 12 starting to go down this path. And a lot of times they're even in the more affluent areas. And in San Diego County, it is becoming a big issue. And so it is statewide. And I applaud your effort with it, and I support the bill.
Thank you. Assemblymember Gonzalez.
I just have a quick question because I caught part of a stat, but I'm not sure. So you said 3% of, was it workers' comp doctors or overall doctors are responsible for 55% of
Yes, it's
prescriptions?
workers' compensation doctors. I can get you the statistic after.
I would love that. It brings to mind another bill.
Additional comments or questions from members? Assemblymember Lackey.
Yeah, I would just like to applaud the fact that we're attempting to make it more difficult for people who have this problem and this compulsion. However, my biggest concern happens to be with the fact that generics are not able to be controlled and take advantage of this particular.
There actually is a generic available now for this formulation, and there are several more in the pipeline.
I'm just saying that I think that that's where people are going to turn, is to the generic
Abuse
brand
deterrent.
because it is cheaper anyways, and I think that is the problem that I really have with this bill at this particular juncture.
Thank you. We have a motion. We have a second. The motion is due pass to Business and Professions Committee. Would you like to close, Assemblymember Wood?
Just to thank the committee for their time. I appreciate that. I agree it's not a magic bullet. It's a step forward to try to begin to combat a problem that is continuing to grow in California. This is the kind of issue that made me want to come to Sacramento to kind of work on these issues. So appreciate that. Ask for your aye vote.
Thank you, Dr. Wood. Madam Secretary, please call the roll. The motion again is due pass to Business and Professions Committee.
Fonta?
Aye.
Fonta, aye. Mainshine? Bonilla? Bonilla, aye. Burke? Burke, aye. Chavez?
Aye.
Chavez, aye. Chu?
Aye.
Chu, aye. Gomez?
Aye.
Gomez, aye. Gonzalez? Aye. Gonzalez, aye. Hernandez? Lackey?
No.
Lackey, no. Nazarian? Nazarian, aye. Patterson? No. Patterson, no. Ridley Thomas?
Aye.
Ridley Thomas, aye. Rodriguez? Santiago? Santiago, aye. Steinnorth?
Nay.
Steinnorth, no. Thurmond? Thurmond, aye. Waldron?
Aye.
Waldron, aye. Wood?
Aye.
Wood, aye.
Bill passes 13-3. Congratulations.
Thank you very much.
Next, we have Assemblymember Gomez. Item number 21, AB 1177.